Welcome to Live with Hillsdale Hospital. Today is March 5th, 2025, and we're coming to you directly from Hillsdale Hospital's studio to provide you information, current events of what's happening right here in Hillsdale County as it relates to healthcare. So we reach out to you in your homes, your businesses, wherever you are, to stop in and today to say we have some exciting news to share with you about some incredible opportunities in primary care. And so it is my pleasure to introduce a good friend of Hillsdale Hospital and someone that I've been trying to recruit for years, and it finally worked. Brandon Douglas, it's great to have you in the studio.
It's great to be here.
Man, you're back home. Does it feel like back home a
It
little
does.
bit? Does
It
it?
does.
Yeah. Seeing some familiar faces and smiles that
Yeah,
you see out of people.
very welcoming.
Yeah, absolutely. So before we get into, how you got here, let's talk a little bit about your background. For our listeners who may not know your story, where you come from, why don't you share with us a little bit about where'd you go to school, where'd you train,
Sure.
what have you been doing, what's your specialty, and
Sure.
maybe just fill them in a little bit about who you are.
Yeah. So, Brandon Douglas, physician assistant, like we mentioned, born and raised in the area. So in Jerome, kind of by Lake Leanne, Lake Somerset area.
Jerome
so,
Country Market, great place to get your steaks.
Yeah. So kind of born and raised, went to Addison High School.
Yeah.
So graduated there, and then went to Central Michigan University. So I got my undergrad there, fire up chips.
Nice.
Yeah.
Absolutely.
So got my degree in biomedical sciences, so
Okay.
my bachelor's there, and then went right after that directly to PA school.
Yeah.
So I went down to Kettering
Oh, yeah.
College of Medical Arts.
Oh, absolutely.
So
Kettering.
So Kettering, south of Dayton.
Yeah.
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 There's the Kettering and
There is.
on the east side,
There
which is
is.
like
Yeah.
a
No, it is.
tech school
Right,
or
not that one.
Everyone
Yeah.
thinks I went there.
No, exactly.
They don't have a PA
No.
program. Yeah. So yeah, in Kettering, Ohio.
Yeah.
It's a small Christian,
yeah.
medical arts college.
Yeah,
Great program.
it is.
Learned a whole bunch and was very well prepared.
Yeah. So, quick question:
Yeah.
Does Kettering still have? They used to have a rural hospital there.
Yes.
Did it close, or is it still open?
Still open.
Okay. Did you
Yep.
do any rotations there?
I did not.
Okay.
I did not.
All right.
So I didn't do any inpatient ones there. I tried to get all my rotations back in Michigan.
Okay.
Just to kind of be better
Yeah.
in the community.
Yeah. So,
And
where'd you do rotations in?
I did some at U of M.
Okay.
And then Sparrow. in
Sparrow and
Lansing.
Lansing. Yeah.
Yeah.
Great.
And then a couple other just private practices kind
Right.
of in the middle there.
Right.
So
So you're at Kettering. You're realizing, you know what? I have a choice to make. Which discipline do I want to go into within PA? And you stuck to family practice, or
yeah, so family practice from the get-go was kind of what drew
Yeah.
what I was drawn to.
Yeah.
Just getting the kind of the full picture with kind of birth till death
Yeah.
care.
Yeah.
And I always had a good relationship with my primary care provider
Right.
growing up, right?
Is that what did it? I mean, so what triggered you
Yeah.
to say, you know what? Instead of going to the other Kettering to do computer science,
Right.
Why do I want to be a PA? Who was your influencer for
Well,
that?
so my family is real big into medicine. So my mom's been a lab tech at, it was Bixby, but now
yeah.
ProMedica, Hickman,
ProMedica,
or whatever.
Hickman, yeah.
So she's been a lab tech there for
Still working there.
Still working there.
Is that
Still
right?
working there. My aunts were at various hospitals doing billing and coding and MRI stuff and all this other
Yeah.
stuff. So growing up, the medical field was kind of right there. Always interested me. Always did.
Yeah.
In high school, I was kind of like, I might be interested in like engineering just because that
Right.
seemed cool. And I was like,
Yeah.
how many math classes do I need to take? I think I'm okay. So
you went science.
so I went science, yeah. So when I went to Central, the cool thing about going into PA school or med school
Yeah.
or vet school, whatever it is, the base core classes are pretty much the same.
Right.
So I knew if I got a biomedical science degree,
Yeah.
then that would kind of let me go in any direction.
Yeah.
So I didn't know between med school and PA school when I got in there what I wanted to do.
Yeah.
And then after kind of shadowing and joining some clubs and kind of seeing firsthand, being a PA was 100%.
That's where you wanted to be.
That's where I wanted to be.
Yeah.
The autonomy, the flexibility to pick,
yeah.
to pick
Yeah.
specialties.
Yeah.
Um,
And
you know,
certifications afterwards too.
For sure.
Great opportunities. Rihanna Pickering, who's with us, she went back, got her degree or her certification in psychiatry and some child psychiatry. That's available for you. A little harder when you become board certified in OBGYN to go back and say, I want to do
Right.
psych services.
Right.
You really don't think about that. So really a lot of flexibility in that
For sure.
program.
For sure. And it was kind of the fastest route to get me to be seeing patients
Yeah.
and making a difference,
Right.
really. And so I kind of made that decision, probably like my second year at Central Michigan, my undergrad.
Right.
And then just kind of fast tracked exactly the blueprint on how to to get into PA schools.
Yeah.
So, I got in right away and found out right away and started PA school before I graduated Central.
Is
it
that
was like
right?
They started in May, and I didn't
wow.
graduate until like the third week of May. So I was like,
So
I went back to walk.
Is that right?
Yeah.
That's cool.
So
that's great.
So my professors worked with me for a little bit.
Yeah, that's awesome though. They worked with you. So how many? So you get through that, and then you have, like this blank canvas, because you can go anywhere in the country. I mean, there's such a demand for advanced practice providers.
Yeah.
But you chose not to go to California, not to go to Texas. You came back to Michigan.
Right.
All right. What was the driver there?
Yeah. So grew up in a close knit family.
Yeah.
Right. And my family's in the area, and like I said, in like the Jerome, Lake Land area.
Yeah.
And so that was naturally where I kind of just gravitated to, and then just did a job search, just looked around, and fortunately I got to start off in Hillsdale, in Hillsdale County.
Right.
So, a huge blessing when it comes to that accord. So, that kind of attracted me back to the area. I got to stay local and stay with family and friends. And like I said, I graduated from Addison High School. So,
how many years did you then? So you came back to Hillsdale. How many years were you in Hillsdale?
4 years.
4 years.
Yep.
And then you left, and you really went to a larger primary care practice. And it was in a larger area, or talk to us a little bit about that.
Yeah, so that was in Jackson.
Yeah.
So I got a job I moved to Jackson, bought a house in Jackson, and then that was kind of a little bigger facility that I worked through. It's still primary care, still family practice.
Right. Bigger catchment of patients, though.
For sure, and got exposed to some different disease states and different groups and things like that, and so learned a whole bunch. Just learned a whole bunch.
Yeah.
And then practiced there for 4 years.
Right.
And then opportunity came.
That's right.
To come back.
For all those 4 years, I've been reaching out to you. You know that.
Yep.
Actually, about 5 years now, I've been reaching out to you to try to get you, and it finally worked out. And primarily because we never even met until just recently.
Right.
But I knew about you, and notwithstanding all the billboards on 127 and 94 that I always used to see, but there was just you have this presence about you of just what our community needs, and I think that's so important. And when we made the announcement that you're coming to Hillsdale, my cell phone just was blowing off the frickin' desk. People texting me left and right. At one point, super fan Ronnie Butcher said, "I love him," and so a lot of fans, a lot of people that, and the reason for that is because of the quality of care that you provide, and you do a wonderful job for our community and our patients. And so, as we transition you to this new role, talk to us a little bit about, and to our listeners, a little bit about what you're going to be doing at Hillsdale Medical Associates, because it's a wide gamut. I mean, you're not just a niche service of saying I'm only going to take care of, people between the age of 18 and 23.
Right.
I mean, talk to us about what you're doing, what that full span looks like, the type of patient that you're seeing them on a daily basis.
So obviously, practicing as a physician assistant and kind of building my own practice, my own patient population. So, seeing kind of birth till death, kind of seeing everyone in between, and I've been in primary care practicing medicine for going on 9 years.
Is it 9?
Right.
That's great.
So 9 years. So it's crazy.
That is crazy.
But just had fortunately worked with really good providers and really good people and doctors and PAs along the way, and I've learned a whole bunch.
Yeah.
Learned a whole bunch.
Yeah.
Taking that information, that knowledge, and now being able to come back to kind of to my hometown community and be able to just to give that care is something that I'm so blessed to have the opportunity. So really, have a wide experience in seeing a lot of disease states, all the primary care stuff. So I'm looking forward to kind of
so let's talk a little bit about what's your passion. Is it all of that? Is it a little bit of that? I mean, if you could say I like it, maybe like it all, but I mean, is there a certain demographic of patient? Are you peds, or do you like them all together? I mean, what is?
I like them all. I mean,
right.
it's vastly different. Seeing a little kiddo than seeing an adult, right?
Yeah.
They each have their own barriers and their own challenges.
Yeah.
The thing that I like the most is getting to know the patient, right? Understanding them as a person,
right?
And then kind of building that relationship from there,
right?
So it doesn't matter if they're 5 or 55 or 95, right? You can still have that relationship with the kiddos all the way up to the adults.
Absolutely.
And once you build that kind of that trust, right? That's the rest is easy.
Oh yeah.
Right.
Yeah.
The rest is, it comes naturally when I build that open door communication where a patient can feel comfortable to come to me and say, hey, this is what's going on, instead of me just getting you in and out of the room.
Yeah.
Right. So that's that's why I do medicine.
Yeah.
Right. Just
I mean, it's obviously the opportunity then from in cradle to grave. I mean, that you can see a patient. You can follow that patient for decades if you want to.
Sure.
I mean, if you have a relationship with them. So let's talk a little bit about, you practice in the big city of Jackson. And, now you're in Hillsdale. Some of the demographics are similar, but in many ways are not. So what is, rural healthcare in Hillsdale County like to practice in? Maybe give a sense to our listeners, because there's many times that lack of access is a concern in communities, especially rural communities. And so people wait longer to go see a primary care provider. And they come to you typically sicker. Sure. And are you seeing more of that? What are you seeing right now, the types of things that you're dealing with?
Yeah, so that's always a barrier. That's always a barrier in a rural health community.
It is.
Which is something that I think the hospital and we're trying to help combat.
Yeah.
But the good thing about, my experience in working in this facility, or I'm sorry, in this practice for, going on a decade, is a lot of these disease states that may need, potentially need referrals to specialists or whatnot. We can manage. We can manage and we can treat. Right. So
it's incredible.
It really is.
It is.
And instead of waiting until things are way, way far gone and be like, I better go to the doctor. Just coming in, having this conversation, and then I can say, hey, we can try these 1 or 2 or 3 things first. And then if these aren't working, then we can put that referral in. Then maybe you have to drive, to the hospital. Maybe you have to drive out of town. But the benefit of having that experience is we can treat and manage a lot of these disease states right in the same office. Right in one office.
It's incredible. Talk to us a little bit about, so all right, you did rotations at U of M, Sparrow, large facilities. Considered even tertiary, and so take that aside, because they're expected to have all the resources. I'm often told when I speak across the country that when I share what we do here at Hillsdale, they're pretty amazed. You have neurosurgery, you have vascular surgery, JJ, you have orthopedics, you have 3 OBGYNs and, a total of 5 providers, and, a lot of folks that are dismayed by that because they're like, that doesn't happen in rural health. Why don't you talk to our patient or prospective patient about what Hillsdale can do, because you can treat a patient for a wide variety of illnesses. You can treat diabetes. You're dealing with the patient who maybe has acid reflux. You're dealing with the patient who has chronic illness, COPD even at times. You'll manage that care. But let's talk about the co-management of patients, because we have pulmonologists here on staff, Dr. Wadwa and his team. We have a wide variety of referral patterns that you can build with urology. Talk to us about how that linkage works. And do you think it's successful at Hillsdale? Yeah.
So the big barrier with primary care in doing referrals is getting the patient in to see a specialist. Right. It's a barrier that
either they're not available or you can't get them in for months
out, or there's issues with communication or whatever maybe.
Maybe even the insurance concerns, right?
Sure. So having these specialists in our own system, it alleviates a lot of those barriers, right? Which is very unique. It's not common.
It isn't.
I've practiced for, like I said, almost a decade. It's hard to find that.
It is.
Very, very hard. So that alone is taking, when we're talking about primary care, we're talking about referrals, patients being seen, patients being treated. When we take as many barriers out of the way, that a lot of them are unnecessary.
Right.
In working with Hillsdale Hospital in our facilities, we can alleviate these pains, right? These pain points.
Right.
So that's fantastic. So we can usually, referrals happen quicker. There's usually less issues for having problems or mistakes because we know that know the office, know the office manager, So that alone as a provider is a breath of fresh air, right? So that's great.
And the other availability for you, Brandon, is that you will have immediate and quick access to these specialty surgeons, or providers, and you can text them and call them. In a big system, that's not always easy to do.
No.
But here, they want you to do that. They want you to pick up the phone. So you can be in the office managing that patient. You know that they need that pulmonology referral. You get them out to Three Meadows for the referral. They need the urology. You get them out Three Meadows for urology referral. That's a beautiful relationship, and it gives you the tools that you need to do the work that you need to do.
Sure. And I can relay that to the patient, right?
Absolutely.
So the patient has a concern. Usually when we're going to a specialist, the concern can be scary.
It's very scary.
And when you can say, hey, I'm going to talk to Dr. So-and-so.
Yeah.
I'm going to give him a call right now.
Yeah.
He'll see you next week, right? Or
Absolutely.
we're going to make sure there's no barriers. That just it improves patient care.
Right. Especially with transportation barriers and cost of traveling. You can just get it right here in your backyard.
Yep.
So you've been now at HMA for 2 weeks, or 2 weeks now?
2.5 weeks.
And I know you're learning everything, but you're smart as a whip, so you probably already know the EMR, you probably already worked on Epic, right?
Yep.
So at the end of the day, can you tell our listeners today a little bit about what you're seeing today? I mean, are we seeing a lot of flu? Are we experiencing high incident rates of COVID? What are you seeing?
Yeah, for me, just seeing just a handful of patients now, I don't have a huge gauge when it comes to like the illness.
Okay.
We do have a couple flus coming in routinely, some COVIDs, right? I mean, the viral illnesses are out. It's just early March, right? So we're still in that window.
Right.
A lot of the patients I'm seeing now are just establishing care with me.
Right.
They're coming in and they're saying, hey, first time I've seen you. Yeah. These are the meds I'm on. These are my chronic conditions. Let's start. This is our baseline. Yeah. So then I know from the get-go, hey, this is the issues or the concerns or the complaints that you have, and let's tackle it right off the get. Right off the get.
So the question I'm getting in text is he seeing new patients? I'm going to let you answer that question. Are you seeing new patients?
Absolutely.
All right.
Absolutely.
So if someone wants an appointment with you, they call Hillsdale Medical Associates, and Kirsten will put the number on the screen for you, and you can contact Hillsdale Medical Associates to schedule that with Brandon. And probably turnaround time, we can be pretty decent with that, I would assume.
Yeah, my schedule's
so you're starting to fill up. So please, if you're listening today and you're interested in coming back to Brandon, or if you're in a situation where you're like, you know what, I don't have a provider, but man, this guy is pretty cool. And we'd like to go there as a family or even as an individual. Certainly reach out to HMA. You'll see the number on the screen. Give them a call, get an appointment scheduled, and Brandon would be glad to see you. So this is some pretty exciting times for us. A lot of growth, a lot of opportunities. As you know, we purchased Hillsdale Medical Associates roughly months ago, and we've been working on that for a year. But it's been a transition, as they all are, that sometimes can be frustrating for our patients, and there's always changeover, right? And so that always is like, wow, they do things a little different, or the phones aren't getting answered right away. But bear with us, folks. It is always difficult when we purchase a practice and we grow it, like we have with you and your colleague Patty Wise is out there. We have Dr. Baker, we have Dr. McCants out there, a very good team, interdisciplinary team of folks. Dr. Muse will stop out occasionally, our medical director. So really a good continuum. And you're only at HMA, right? You're not bouncing anywhere else, right?
Nope.
So HMA, Hillsdale Medical Associates. If you're interested in an appointment, please give us a call. We'd love to be able to have Brandon see you and give you the Hillsdale Hospital welcome, which is taking care of you in any state that you're in. Remember, these are providers who are family practice, and they can see a wide gamut of individual issues and concerns, health-related, that you may have. If there's issues that go beyond what he feels comfortable doing, or anyone in the practice does, we have the referral opportunity within our system. So if we need to address something for a general surgery, then you'll go to general surgery, but you'll come back to the practice, and he'll have a chance to look at your records, and that's a relationship of sharing EMR between our clinics, the electronic medical records. So lots of opportunities that do exist out there for you as a new patient or as a returning patient, and you're interested in getting in. Get a hold of him now. I kind of have a suspicion his schedule is going to fill up very quickly. So if you're listening today and want to do that, please reach out. We'd love to hear from you. At this time, I'm going to ask Kirsten, because I got to get you back to the clinic. Kirsten, are there any questions or comments that have been made on today's post? None. All right. Well, the good news is that this will get posted after the live, and it will be shared with lots of folks. And we would encourage you, if you have a question, whether it's for Brandon exactly or for us in general, please put it in your comment section, and we will get to that question. A lot of folks review this after, it's a live event. And if you're looking for a place for primary care, you have to look no further. So it's been great to have you here today. I want to get you back to the practice. I'm excited. Like I said, this has been a long time in coming.
Yes, sir.
I know that you're going to do a remarkable job out there for our patients. You're going to embody everything that our mission, vision, and values stand for. And I'm just excited to see where this goes for us.
Me too.
Right? So welcome to Hillsdale Hospital. If you're listening today and you want to be part of this, please reach out to Hillsdale Medical Associates. To close, we want to thank you, our community, our listeners. Thank you for using our services. It's the work that we get to do every day to take care of you, but we need you to come into our facility utilizing our services so we can continue this great work. When you think to yourself, bigger's better, I'm going to go to University Hospital X, or I'm going to go to this big system. It's not always the case, is it? Just got him on a drink of water right there. Not always the case. Bigger is not always better when it comes to healthcare, because it can be specialized at the local level right here. And then access to other specialty care, we have it. So we thank you for being a faithful patient of ours, a contributor. Maybe you've sponsored something for us. Maybe you've given to our capital campaign. That is wonderful. Maybe you're thinking about ways that you can help us. So beyond just becoming a patient within one of our practices, there's plenty of opportunities for you to get involved. You can always just think a healthcare hero. Go to our Facebook post. Say thank you to someone in your family that may be involved in healthcare at any level. I mean, think about what your mom did during COVID. I mean, she was busy, and she just think how the labs were just overwhelmed during COVID, processing, and so everyone in healthcare, right, that touches our patient is valuable. It's not just putting a physician or a provider or an administrator up on a pedestal. Every one of us have a vital role. When you walk in that front door, it's the admitting clerk who greets you. You're going to remember that. You're going to remember when you walk into the clinic how you were greeted by the front desk receptionist, medical office receptionist, and how you were greeted by the medical assistant. And so we pride ourselves on making sure that this is an environment where patients will want to receive care and where we deliver that care in an environment that encourages you to come back to utilize us. So if you're looking for a way to use those services, go to our website, hillsdalehospital.com, and you can see the various types of services we offer, whether it's pulmonology, whether it's urology, whether it's primary care. All of those listings are on our website. Maybe you're interested in joining a winning team. Who wouldn't want to work this guy, right? Maybe you want to work at Hillsdale Medical Associates. We have job openings and medical assistants and other opportunities that are always available in our clinics. Quite a few job openings, in fact. Great insurance, great pay, great environment, great opportunity to serve your community right here in your backyard, and opportunity for education assistance where you can go to school if you want to become a PA. We have done that before. If you want to become a nurse, we will absolutely do that. So there are plenty of opportunities for you if you're looking for employment. Maybe you're looking to volunteer. Another great opportunity, go to our website. You can certainly see opportunities under our auxiliary or volunteer division. And we have a whole host of individuals that come in every day to help supplement the work that we do in healthcare. And it's wonderful. They come in, they volunteer. We have a beautiful gift shop. Have you been there yet? Oh, man, you got to go there. Great place. Voted the best gift shop about 6 years ago.
Really?
In Hillsdale County, yeah.
Oh.
And so we're excited if you want to come in to use our services, but even more so if you want to volunteer. And if you're interested in either of those opportunities, whether it's employment or volunteer, go to our website, hillsdalehospital.com. Under the career tab, you'll find all the opening jobs. As told by HR, there's well over 30 now that are available from a variety of positions. So please give that consideration. We look forward to seeing you back here next week. We're going to have a radio segment this week where we talk about some of these same issues. You can catch that on 92.1 at every Friday, and then on Saturdays, 89.5, opportunity to hear the same program that we have on WCSR, really just talking about what's happening in healthcare in Hillsdale County. So we look forward to seeing you next week, and until then, stay safe, stay healthy, and stay Hillsdale strong.